PARP inhibition has been very successful in ovarian cancer. Gastric cancer is also a platinum-sensitive disease, therefore PARP inhibition has been of interest for patients with gastric cancer. There's been a previous phase 2 randomised trial examining paclitaxel plus or minus Olaparib in gastric cancer, and this demonstrated a statistically significant improvement in overall survival. The GOLD study was a large randomised study conducted in Asian gastric cancer patients in which there was enrichment for an ATM deficient cohort. The results for the trial overall demonstrate a trend towards an improvement in overall survival. However, due to correction for multiplicity because of co-primary endpoints, the results were not statistically significant. Well, this is disappointing for patients with gastric cancer. However, there were improvements in response rates, progression-free survival and overall survival demonstrated in the study. Therefore, PARP inhibition may be helpful to subsets of patients with gastric cancer. Markers of BRCA or sensitivity to PARP inhibitor include not only ATM deficiency, but also markers of genomic scar such as loss of heterozygosity. And exploration of these in patients with gastric cancer may reveal subsets who are sensitive to PARP inhibition. In this Japanese study, the value of the addition of intraperitoneal paclitaxel chemotherapy was assessed for patients with peritoneal metastases from gastric cancer. This is a difficult patient group to treat because we know that they have a poor prognosis. In the overall group, there was no statistically significant survival benefit for the addition of intraperitoneal paclitaxel to standard cytotoxic chemotherapy. However, some sensitivity analysis were performed which demonstrate that possibly in patients with more ascites that there is value to intraperitoneal chemotherapy. Although this does not represent a change in the standard of care for patients with intraperitoneal metastases from gastric cancer, these subgroups are worthy of further exploration in future research. The rationale for this study was that we know that 20% of patients with oesophagogastric cancer have HER2 overexpression. We know that in the metastatic setting that the addition of the monoclonal antibody trastuzumab helps these patients to live longer. The addition of lapatinib to ECX chemotherapy with a slightly reduced dose of 5-FU was safe and feasible. We saw a relatively low rate of significant diarrhea and also slightly increased rates of neutropenia, however, no increased rates of complicated or febrile neutropenia. As this was a dose-finding study, the implications for this on clinical practice at the moment are limited. We found that it was safe and feasible to give lapatinib with reduced dose ECX chemotherapy. However, a larger trial would be required in order to change the standard of care. The results of our trial and the results of the innovation trial, which is an EORTC trial assessing the effects of trastuzumab and pertuzumab in this setting, will help inform future trial development and possibly at a later stage clinical practice.